everyone, and thank you for joining us on Aging Conversations. My name is Aman Fazal. I'm from United Way, British Columbia, and I'm here on behalf of my colleague, Barbara McMillan, who is the Provincial Community Engagement Coordinator for United Way, British Columbia Healthy Aging. I'd like to start by acknowledging the traditional ancestral territories of all First Land Nations in the land we now call Canada, on which we gratefully work and gather. The On Aging Conversation series is a collaboration between Healthy Aging Core and Help Age Canada. If you've missed earlier episodes, you'll find them on Apple Podcasts and Healthy Aging Core Canada, the knowledge hub connecting agencies that support and advance independent living for older Canadians. You'll also find the lineup of On Aging speakers on Core, as well as delivered to your inbox if you've signed up for the twice-monthly Core e-newsletter. In our work with Core, Help Age, and the extraordinary network of community-based senior serving agencies, volunteers, and professionals, we're privileged to encounter many thought leaders and innovators in the field of healthy aging. And so On Aging Conversations was launched to help bring some of these ideas, innovations, and perspectives to a wider audience. And that's it, 30 minutes of healthy aging information and inspiration every few weeks. I'll now turn it over to Gregor Snedden, CEO of Help Age Canada, your host for On Aging.
Thank you, Aman, and Happy New Year to everyone. I hope you all had some good holidays, and also a happy Christmas to all of our Orthodox friends out there that are heading into Christmas over the next couple of days. And in fact, I happen to be in Krakow, Poland right now for this conversation, and as I head into Ukraine in the coming days, and had the treat to have some delicious Ukrainian food actually when I arrived. Help Age Canada, for those of you who are unfamiliar with Help Age, we support community-based initiatives through our partnerships across Canada and abroad to improve the lives of older persons and their communities. We work in Canada with the community-based seniors services sector. We operate a number of different programs, and we also work internationally. That's why I'm in Poland today and heading over into Ukraine. Today, I'm really excited to be introducing you to Marta Hajek, or though most of you will know Marta already. Marta is the Executive Director of Elder Abuse Prevention Ontario, and she's been involved in elder abuse prevention since 2013. She has worked with the organization for a long time, but even before that, she was appointed to the Ontario Securities Commissions as the Senior Expert Advisory Committee in 2016 and continues to serve on the board of the Canadian Network of the Prevention of Elder Abuse. More than that, she holds a degree in geology, statistical analysis, and linguistic cultural studies. And she's an avid supporter of the arts, an aficionado in opera, and also an incredible gardener. So very rich persona here that I'm always delighted to speak with and run into, and it's just an absolute pleasure. And Marta also happens to be Ukrainian, so I'm just thrilled to be having all these stars aligned today for our conversation. Welcome to Healthy Aging, Marta.
Thank you very much, Gregor, and Happy New Year to everyone that's listening.
Super. Well, listen, with such a background, I mean, my goodness, can you tell us a little bit about, your journey and how you arrived where you are now with Elder Abuse Prevention Ontario? What was the road? Can you sort of paint a little picture for us?
Well, like most, I started off in the corporate sector, working on telecom and various other customer service-based initiatives in the community. But I very quickly realized that it is about the sense of community. And so the draw to human services was almost logical. We are surrounded by aging individuals, as we are each of us aging. And we started to notice that there is a lot of inconsistencies in terms of services being provided, more of a discriminatory approach to older adults being perceived as frail. So I thought, why not get into this? So I kind of drew into that file cabinet of expertise and lived experiences and started to apply this to the nonprofit sector.
I find it really interesting, your interest in both opera music, for example, and geography, as well as statistical analysis. How do you draw on those resources in this work?
It is about capacity building. So geography, geology for me is as a foundational thing of our Earth. It influences the climate crises that we are experiencing right now. So it is really grassroots in the entire aspect of that word. It's building those foundations for other things. So I like the solitude of being out in nature, and that allows me to always rechannel my thinking, my energies, and come back, hit the ground running, as they say.
Awesome. Tell us a little bit about Elder Abuse Prevention Ontario, and also how does that fit in with the Canadian Network for the Prevention of Elder Abuse?
Elder Abuse Prevention Ontario has had different iterations of name, and only in 2014 did we actually include the word prevention in the company's name. We've been around since 1992, and the organization was established by Dr. Elizabeth Podniaks, which again, I'm sure many people are familiar with. In 2006, Elizabeth addressed the United Nations and called for June 15th to be marked as an annual World Elder Abuse Awareness Day. Since then, that momentum has been growing, and Ontario is only part of the Canadian network. So we have counterparts across Canada in each of the provinces, each of them differently resourced because it really is contingent on what provincial governments are prepared to invest around elder abuse prevention as a whole. We have a very modest staff group, and only in 2002, when Ontario introduced the first strategy of its kind in Canada around combating elder abuse, was our mandate really then defined. So with that modest staff complement, things that we do are to work with local area networks. For example, as of last night, we have hit our 40 mark in terms of those networks. At one time, we had 57 networks, and again, volunteer fatigue set in, the pandemic hit, all kinds of issues impacted that. So we're slowly starting to build up that reserve of community resources. These are volunteer-based community committees that help address and coordinate some of the interaction that various stakeholder agencies can have in supporting vulnerable populations. We do a great deal of public awareness building through educational forums. So whether they're workshops with a local cultural group or a multi-faith-based group, we provide education around what those elder abuse signs are. What are the warning signs? What does one have in terms of their local community to help respond to that senior that is experiencing the difficulty? And then we also do a great deal of frontline service provider training. So across all sectors, whether it's the justice sector, local police departments, healthcare providers, we provide that level of training that is very specific to that sector and to that daily practice. When COVID struck, we essentially pivoted from a in-person service delivery model to a virtual one. It has been a bit of a struggle because a great number of seniors were isolated, were in lockdown, and it's very hard to know what's going on behind closed doors. So one of the statistics that we really always put out there is that 93% of older adults live within the community, which leaves only 7% living in congregate settings. That's a huge shift for us in terms of thinking because there was so much emphasis put on the abuse happening in long-term care, the levels of neglect, and the number of seniors that were dying in long-term care facilities. But it's really our work within the community to build awareness around elder abuse. And everything that we do with that preventative lens. So what can we do to empower people to look after themselves, to safeguard their financial assets, and know where to reach out when they have a situation that they can no longer cope with?
Well, you and I both participate in the Canadian Coalition Against Ageism. And
Yes.
as you know, even the term ageism is a new term for many people, dare I say most people. It's not something that is really on people's radar. And I've discovered as well that when we sometimes talk about elder abuse, people are, in some cases, it's a new idea. It's a new concept that speaks to our whole issue of ageism as sort of this invisible group of people out there. I wanted to just, on your website, which is a great website, by the way, EAPON.ca, lots of resources and great information there. I wanted to talk a little bit about the definition there that is stated there. It says, Elder abuse is defined by the World Health Organization as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. Elder abuse often occurs when there is an imbalance of control. The abuser either limits or takes control over the rights and freedoms of the senior. The abuse violence is used to intimidate, humiliate, coerce, frighten, or simply to make the senior feel powerless. It also states that unlike other acts of violence or exploitation, elder abuse is recurrent in up to 80% of cases, which is just astonishing. Newly released elder abuse prevalence and risk factors findings from the Canadian longitudinal study on aging state that 1 in 10 older adults across Canada experience some form of elder mistreatment each year. I mean, this is astounding.
It is astounding. And we often refer to elder abuse as a hidden epidemic because it is so seriously underreported. You know, the statistics are one thing. These are people that have actually disclosed and reported situations of abuse. But we know full well that, again, behind those closed doors, there are a lot of situations that continue to happen. Issues around family dynamics, for example, or the other issues around poverty being experienced, or the dependence of family members on each other that confine people to live in close quarters, which only exacerbates that situation and makes it more difficult for the senior to either step away. One of the things we also know is that there is a reluctance to report. Now, there is no mandatory reporting within the community. There is in congregate settings like retirement homes and long-term care. But in the community where it is a family situation and the older adult is dependent on the very people that are perpetrating the abuse, you know, for basic necessities of life, it makes it very difficult for that senior to finally pick up the phone and, you know, call the police because they are being physically abused, or those basic necessities of life are being denied. And so we know, for example, that people start to look, you know, a little bit more disheveled to their neighbors, or, you know, they're losing weight, or there are definite signs that we look for and make people aware of those warning signs that they should be looking for. So if something is not feeling quite right with your older neighbor or a family member, it's time to start that conversation and find out what's going on.
Some other statistics that were interesting was older adults who experience higher levels of childhood mistreatment were more likely to experience mistreatment in later life. And also older adults with greater vulnerabilities related to physical or cognitive and mental health status also experienced a higher level of abuse or mistreatment later in life. As we know, in Canada, we're looking at not too far from now, 15 years or so, by 2036, 1 in 4 Canadians will be over the age of 65. And that's an aggregate average. So that means in some places it's even higher than that. Clearly, this is something that we need to be getting on top of. I wonder if we might just take a minute just to chat a little bit about some of the forms of abuse that we're aware of, and again, that you outline on your website, including financial abuse, psychological abuse, physical abuse, sexual abuse, neglect, systemic abuse. I wonder if maybe we might just chat a little bit about that.
Sure. So again, the prevalence study was done in 2015 by the National Institute for the Care of the Elderly, and they reported what those statistics are that we all use now in our presentations and discussions with various stakeholders in the community. But we know, for example, physical abuse is something you can readily recognize. But the harder thing to get at is really the emotional piece. And we also know that none of these abuses happen just as one thing. It's the complexity of dynamics that are happening. So emotional abuse, for example, saying that you can't see your grandchildren unless you sign over your bank account to me. That is a threatening thing. And we already know about the impact of this because we deal with various groups that are advocating for grandparent rights. But the more harmful piece of all of this is the financial abuse. The demographic right now that you mentioned, Gregor, that there are more people now over the age of 65 than there are under the age of 15 in Canada. This is also the demographic that holds the greatest amount of wealth in history. that wealth can be swept away very quickly. And the assets that the older adult has been accumulating over the course of their life can be taken away within one phone call. So the financial abuse is extremely prevalent. It's the second most prevalent in Canada, and it is causing increasingly more harm. So some of the work that we do with the Securities Commission is to try and look at how to safeguard more of those financial assets of older adults so that they are not suddenly left without anything, and how do you deal with your life going forward. So it definitely does impact on the quality of life.
One of the things that's always of interest to us is some of the differences in our urban and rural communities and other communities, Indigenous communities or people that non-official language speakers, new Canadians, refugees. What would you say are some highlights or some what are you observing in these various communities? There might be some common and also different themes that may be happening there.
Clearly what we've seen, and again, over the last couple of years, we've seen a 250% increase in elder abuse situations. Wow. But when people reside in urban centers, they're more likely to be interacting with their neighbors or have been part of a community group and suddenly stop coming. It's a little bit easier to catch those kinds of scenarios. In rural environments where people are more isolated, there are less likelihoods of having a community center that is close by. I mean, as we get older, that privilege of being able to drive everywhere we need to go, that starts to tear away. And the access to transportation to those community centers where they become those social hubs where we then can say somebody's looking a little bit undernourished or they're perhaps looking more disheveled, it's less likely to become apparent. And that is an issue. As well, those resources within communities are not equitably spaced out. So you have more likelihood of being able to get to a legal service, a medical service. Even a food bank within the city is more apt to happen, whereas in rural environments, those resources don't consistently exist across the province.
I know that you've done a fair amount of work as well in Northern Ontario with Indigenous communities. I remember that during the pandemic, as you well recall, we were doing some advocacy work with the federal government to look at how we could engage there and even doing translation work for awareness building in some of the multiple languages and so on. And in Indigenous communities as well, there's also a tradition of respect for elders, but often we have discovered in our dialogue with elders in First Nations communities that it doesn't always play out that way. It can appear that way, but there is ongoing abuse issues in those communities as well. Can you comment a little bit about that?
Yes, absolutely. And that is entirely correct. So when COVID struck, it wasn't that suddenly all these issues just suddenly appeared. They've been ongoing for the longest time, and they only came to light more so because of the pandemic. In the more remote areas, and particularly around Indigenous communities, we really had no opportunity to interact. One of the things that we've undertaken over the course of these last year and a half, is to start engaging and having those conversations. They are intended to be not us speaking at Indigenous communities, but speaking with them to learn more about, is there an awareness of abuse? Is there a recognition of what it is that might be happening? How are they as communities dealing with these issues within the resources that they have available? And really not coming and injecting ourselves with, this is what you need to do and this is the resources for you. But it's really having active conversations with the elders in the community to find out how can we help. And more so, how can we learn from each other how to best approach this within Indigenous communities? And I have to say, we've had tremendous success. I have had the privilege of speaking at several elder gatherings and been met with the warmest reception that I could have envisioned. I'm humbled by what I've learned. And I also recognize that there is an opportunity for us to forge a stronger relationship. Being mindful of, you mentioned in your past discussion, Gregor, about the truth and reconciliation, about the trauma-informed situations. We recognize that now with the residential school experience, what an impact this has had on the mindset of Indigenous communities. We need to be respectful of that, and we need to find true, genuine ways that we can help. And not just be providing lip service around, this is what we've learned, this is what we found. How can we truly help? And we are being received, and there have been some ongoing discussions around even developing local Indigenous peer-to-peer support networks where we can help that community deal with some of these situations. So a residential school experience where someone has experienced abuse, that abuse then translates into future generations and behavioral issues. So it's not something we need to sort of shelve and put into a white paper, but we need to deal with this actively.
In our work with HelpAge internationally, in many countries that we work in, there is no social security system at all. There's no foundation for it. The advocacy in some cases is just at a very beginning stage. So as an older person, when you stop working, if you're fortunate enough to have family to live with, then you immediately become a dependent and you live with that family. And if you don't, then you're destitute and end up on the street, which is the worst case scenario. But even as oftentimes older people move in and become a dependent on a family, there's often a cultural implication or narrative that it's not right for the older person to quote, quote, complain or share their needs. They're meant to take a background supporting role and to remain quiet. And that's where a lot of neglect and abuse can happen. And we had the privilege on our show here last year to interview Ann Keynes of the organization RICA. Are you familiar with RICA?
Yes.
Out of Montreal, and they work with a new Canadian immigrant communities to try and share the experience of aging and abuse and neglect that happens in those communities in a safe, appropriate way through silent theater. And I just thought that was a marvelous way to engage in a respectful, loving way to bring out these issues into community. I just thought that was fantastic.
We've been involved with a couple of theatrical groups here in Ontario that have taken a similar approach. They create skits and little vignettes around what might happen at a dinner table and what role does each person around that table play, not only in the family dynamic, but respect for the elder. And, I grew up in an Eastern European home where kids were, seen but not heard. That has definitely changed. But those kinds of things that are cultural, that are imposed, and helping people recognize that in Canada, there are different cultures, there are different newcomer groups, immigrants coming from all walks of life from around the world. Those traditions come, but with it has to be the opportunity to restate the respect, restoring that respect and making sure that the abuse doesn't get perpetuated.
Mm-hmm. Well, hey, it made me think, Marta, with your background, maybe there's room for a opera sharing. You could do an operatic as opposed to theater. Wouldn't that be something? I think that'd be fantastic.
It would be. There's opportunity to use the arts in a lot of different creative ways. So I'm certainly open to that.
All right. Well, we'll follow up on that another time. We're just about out of time here, but could you just very quickly state a couple of words about the signs that we should be paying attention to? And as Canadians, and also those of us who are working in the community-based senior services sector, what should we be looking for and what resources are available to us to draw on?
So in terms of resources, we invite everyone to visit our website. We're very proud of it. We've just revamped it within the last year, and we keep parking a lot of tools, resources, vignettes, both English, French, and other languages, things that can help people become more informed about what's going on around them. It is one way to protect ourselves, but it's also a way of safeguarding our neighbors and friends. Most importantly, we have to check our own ageist attitudes because those attitudes are influencing how we behave, how we perceive, and then how that gets translated into use by policy and decision makers that have greater control over legislation or those protections to ensure that human rights are not being abused.
Awesome. I'm afraid we are out of time. And I just again want to thank you so much, Marta, for taking some time out of your busy schedule to be with us. Again, I encourage everyone to check out their website, which is EAPON.ca, Elder Abuse Prevention Ontario, EAPON.ca. Let's work together to support one another in addressing elder abuse and ageism, that we can create a more full and equitable and safe society for all of us. So thank you so much for being with us today, Marta.
Thank you, Gregor. Thank you for having me.
And I would just like to say, I hope for all of you who are with us today, you can join us again on Thursday, January 26th. I'll be speaking with Victoria Panchenko of HelpAge Ukraine. I'll be visiting her out in eastern Ukraine, visiting some of our programs supporting older people in their winterization over this difficult season. So that'll be a really interesting conversation, and very much looking forward to that on the 26th of January. Thank you very much to Amon and Core Canada and all of you who joined us today, and wish you all a happy, healthy new year.